I mean, that's what we've done, really. We've given up comfort for reality.
Oh.
And I for one, would rather... It really is a matrix situation.
But I didn't have the comfort in the first place.
No, you're ahead of the game. We talked about that.
I was, as far as I know, I'm one of the only doctors who said at the start, I was trying to get on as many radio shows, and they had me on initially, and then the censorship got in the way, and I said, this is a really bad idea. The collateral damage is going to be insane. Yeah. We should not be doing this. And I got threatened with my job as well.
I wish you'd talked to me in 2020, Tim. You could have saved us a lot of
But if I'd have tried to, would you have listened?
It's a very good question. So,
I mean, you know, we got the new. Well, like everyone else, I get slightly out of step on exactly how long ago certain things were. But when they were suggesting that we're going to shut the schools, the very first time they shut the schools, and our kids were 5-6 years younger than they are now. They were all still at school, and Trudy and I were, oh my God, if they're threatening to do this, there must be something. This must be really, really bad. You know, we did get prickled with the panic because we thought, if the Prime Minister's saying it and if the senior scientists are all saying it, who are we to? And we couldn't get the kids out of school fast enough on the first Friday
because we believed them.
Yeah, but it didn't last. Within a couple of weeks, within a couple of weeks, we were saying,
hang on a minute.
Hang on a minute. I mean, we did get barreled along. We got knocked off our feet to begin with.
No. That's pretty. A few weeks is pretty quick. You did well.
Yes, but we were also there was naked self-preservation going on there as well because I'm a self-employed person.
You need to make a living,
and all my avenues to keeping a roof on the house were cut off. So Trudy and I were looking at each other, going, a couple of days, couple of weeks, maybe, but if this runs to 6 months, we'll be.
So my alarm bell was ringing straight away because I was hearing the term modelling, and my first degree being computer science, and actually my dissertation was on modelling of traffic. So I've had a taste of modelling, and so I know for an absolute fact that as soon as you get over a couple of variables, you can make a model tell you anything you want. It's just a complete nonsense using modelling in that way to direct a sort of pandemic response.
Neil Ferguson,
like
So as soon as you heard the modelling, that was an alarm bell. As the ticker tape, the police tape around the children's playground, that was an alarm bell. And then just the whole, it was just obvious to me that you'd have this goalpost effect that would just get wider and wider and wider. And that's exactly what happened. And it just seemed like these lockdowns are never going to end. Yeah. It was just absurd.
Yeah.
But I was like Neil, we originally believed it. I mean, I remember the first Downing Street press conference, it was the Prime Minister, the Chief Medical Officer and the Chief Scientific Officer. And my wife said, well, that's what you want, isn't it? The Prime Minister, the Chief Medical Officer, the Chief Scientific Officer. Little did we realise that subsequently there was questions about all three of those individuals.
Yeah.
Well, and then so the establishment has made a complete fool out of themselves, and it's there for the world to see. But
not many people see it because of the control of the media narrative. This is the problem.
To get back to that point I was making about the people preferring to turn away rather than contemplate the enormity of what is actually probably did happen. There's a great way of thinking that I ran across called the staircase of disbelief. Have you heard of that?
No.
And it's, the idea is that if you imagine a staircase just going up into the sky, sort of Jacob's ladder style.
Yeah.
And you don't really know where it goes. But the first step, it could be a different step for everyone, but let's just say your first step happens to be accepting that what we were always told about JFK's assassination wasn't the story. Mm-hmm. So you're up on, and you accept that was an inside job. So now you're on step 1 of the staircase. It's got 100 steps. Can't see to the top. And so then now you're on step 1. Mm-hmm. So the likelihood that you might go into step 2 is 100% greater than it was when you stayed off, when you were still on the ground.
True.
And whatever, step 2 might be 9/11. Mm-hmm. Maybe if they lied about JFK, maybe they're not being completely honest about what happened in 9/11. Now I'm on step 2. And so the problem is, well, oh God, now I have to contemplate step 3, which when you were still on the ground, step 3 would have been utterly inconceivable. You'd never have gone anywhere near step 3. But it's like a gateway drug. Mm-hmm. It's like a couple of puffs on a marijuana cigarette. You're a bit more likely possibly to try something else. So up you go. So so most people don't want to. They know that if they allow a little chink of light into their darkness, oh God, then I might actually have to open the window
Oh, shit.
and look outside. So I'll just stay in here.
And that's your point before, recognizing the truth is unconscionable because it is so massive, and it makes the rest of your life up to that point, in a sense, non-valid.
Exactly. I was 55 or something 53 when this all started. And you have to contemplate thinking, I may have been being duped for 53, 54 years of my life.
That's what it means, and that's not nice.
But not just recognizing the truth, recognizing uncertainty as well.
Yeah.
Because I think that one of the biggest problems is that people want to be certain about everything. And, I don't know.
It's a comfortable place to be, isn't it?
It is, yes. And to think that there's these experts who know everything to keep you nice and warm, I can see that would be nice for some people, but I suppose that because I've got all these different perspectives, I know that there isn't certainty, and there's a lot of uncertainty, especially when it comes to, when we go back to talking about drugs and, the clinical trials and the lack of evidence for long-term harms and all that kind of stuff. There's a huge amount of uncertainty out there, but people want to believe that there is certainty, safe and effective, safe and effective, safe and effective. But so actually the world is grey, it's not black and white.
Another thing that's come out talking to world-leading experts, so I've talking to the world-leading expert on immunology or cancer or infectious diseases, and the amount of things they don't know, and they're honest that they don't know. And yet this is the guy or the woman who purportedly knows more than anyone else. Mm-hmm. And they've got doubt and uncertainty, and yet you have people right down at the hoi polloi, relatively minion level who seem to think that they know. Well, actually, when you're dealing with something complex like the environment or like the human body, you don't actually know.
Well, exactly. What you should do when you come out of medical school is you should recognise how little you know about the human body. Tiny amount. You've learned all these reductive models, simplistic sort of cartoon models of the human body, which, to be honest, that form of learning where you can simplify everything down and then say, having this simple drug is going to fix this problem. When you understand that actually, the human body is so complex that it's very unlikely that a simple molecule is going to be able to fix that without causing a huge amount of downstream problems that are going to come back to bite in however many years. That's a key part of the problem, that humility to say, actually, I know enough to know that I know nothing. And Socrates said that. Yeah.
Uh-huh. I want to talk to you about maybe one or two specific examples in the future in a minute. But first of all, I'll tell you my story briefly. You up for that?
Yeah.
Absolutely.
Yeah. So I was a psychiatric nurse when I was 18. I did that for 3 years. Then I was a general nurse. Then I worked abroad and did quite a few different jobs. Worked on theatres, worked in refugee camps. Then I started going into academia. So I did something called a diploma in nursing, which was really hard in those days. Then I did a degree and a master's degree and a PhD and became an academic and became a researcher. But my main job really was teaching. So I taught student nurses. A few medical students would drift in, a few physio students would drift in. But it was healthcare education. And that had to be evidence-based. Now, you could go back and look at the primary source evidence, and we did to a degree. But that's not really what would stand up if there was any serious question marks. What would stand up is, what do the guidelines say? So, for example, I taught care of anaphylaxis. That was one of the things that I taught as part of intravenous therapy. I started teaching intravenous therapy to non-doctors. And the British Resuscitation Council would update the guidelines from time to time, and you had to make sure you would teach exactly what was in those guidelines. And most times, it made sense. Resuscitation was another one. Every few years, the Resuscitation Council would change the guidelines based on expert opinion. All seemed to make sense. Teach the latest guidelines, get better outcomes. It all seemed to work. And that's what my entire career was predicated on. While we did some primary research, basically what we taught was based on the guidelines, the current guidelines. And then when I retired from academia, working in A&E, again, everything was guideline-based. So a new patient would come in and the consultant would say, let me think about that. No, that didn't happen. They'd say, go and look up the protocol for this. And it's on your computer, the National Institute for Health and Care Excellence, which I've always thought is a rather Eastern European title because it's got excellence in the title. anything with democratic or excellent in the title is probably not democratic, probably not excellent, but passing that by. And we would follow that really quite meticulously, quite religiously, really. Because if he didn't and something went wrong, the first question would be, did you follow the guidelines? Mm-hmm. And if you say, no, I know better than the guidelines, oh really? You had to follow the guidelines. So when COVID came along, I still had this deference to authority. And I followed the guidelines. Looking back, I was wrong. No two ways about it. And more evidence came along. And if I have any saving grace at all, it's that I tried to follow the evidence. C.S. Lewis, follow the evidence wherever it leads. And it could lead to a really horrible place. And in some sense, it does lead to a horrible place, but you follow it because that's the nature of reality.
And was it gradual for you, John?
Well, what happened, so basically throughout 2020, I accepted the narrative. And then 2021, question marks started coming more.
Because you had your dog with the mask on and everything in the background, didn't you?
Well, I believed what we were told.
Yeah.
I got that wrong. Mm-hmm. I believed the narratives. I'd done what I'd done for the past 45-year career and followed guidelines, which, to be fair, had served pretty well up till that point. Mm-hmm. So, the guidelines on antibiotic therapy, on sepsis, they all made sense, and I could see them at work saving people's lives. There was a rationale to it, and it all kind of made sense. So when the odd things started coming up that didn't quite make sense, you'd hear a death from a vaccine, and you think, well, this happens. I've seen people die from paracetamol, not from ibuprofen. We've treated it, but I've seen people who would have died from ibuprofen without treating it. Unfortunately, happened. So at first, I still accepted the narrative, but then the evidence accumulated. And what was the main thing in my mind was people talking about vaccine injuries. And I started talking to people about the vaccine injuries they'd had, and I realised these weren't isolated cases. And that's kind of what started the questioning. And that developed from there over really a 6-month period, really, from maybe the end of 2021 to the beginning of 2022, realising that this is actually a house of cards, a lot of this. Then they came to realise how much financial investment people had, how much control investment people had, and how that was affecting, how was that, some might say, dictating the narrative. So having believed that, my superiors were working on science, which I think, to be fair, they had done for a lot of my life, I was in this horrible situation where I realised they hadn't. Now, looking back, even the science I followed for my entire career was somewhat biased, because that's based on what's in British National Formulary, that's based on what's in the NICE guidelines, and I thought that was based on evidence. But actually, where does that evidence come from? Well, very often that evidence comes from people that have paid for that evidence to be collected.
Exactly.
So I took it back a stage further. And the other thing that really brought it home to me like a ton of bricks was the repurposed drugs. Mm-hmm. I talked to doctors around the world who were saving lives with these drugs. They were branded as horse medicine, horse paste, and other drugs. And I realised that these doctors I was talking to were really experienced, clever clinicians. And when they told me something was working, you can't ignore that. And yet people were saying, this is rubbish.
I had a moment watching the Dark Horse podcast that Brett Weinstein hosted with Steve Kirsch and Robert Malone.
Yeah.
It's like 3 hours worth of stuff. And I found it jaw-dropping because, Steve Kirsch talked about ivermectin and he talked about repurposing. That was what he was in the business of. He was in the business of, whenever something happened, they would say, well, what have we already got? Yep. Does it also work for this? Let's do this kind of thing. Yeah. And then when I realised that it took no time at all to look up ivermectin and find out all about ivermectin, which was that it was this wonder drug that had been, had been
Nobel Prize 2015.
And it was a wonder drug, and it was in such and such a health organisation's absolute toolkit that you've got to have. Make sure you've got ivermectin wherever you're going, because it'll definitely do no harm, and blah 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 blah. And I thought, And yet, obviously Joe Rogan, who had taken it, was being ripped apart because everyone and anyone was saying, "Oh, Joe Rogan takes horse tranquilizer."
Ferociously attacked.
And you thought, but if you just Google it, it tells you all this stuff about how it's been given billions of times and it's for river blindness, but it's also an anti-inflammatory, blah, blah, blah. And I thought, that's clearly, there's got to be something. There's something badly adrift here. But why? And you got castigated because you had been, as what you've just said. But I found your story amongst the most affecting because you changed course.
Yeah. You changed.
You could have doubled down. You could have just stepped away from it. You could have just, turned off the lights. But you didn't. In the face of everything you had said, you then started saying, "Hang on, So I thought, while you were being ripped into by some for that change, I thought, no, wait a minute, that's.
Yeah, I've seen people put videos up of you back in 2010 and criticise you for saying, but he was saying to take it or whatever. But the
that's
thing
the whole point.
Yeah,
the whole point was that John thought that and honestly said it because he thought it. And then he's read enough and talked to people and he's changed 180 degrees on some of this stuff and now he's saying that. I thought that's what you want.
There's a book called The Illusion of Evidence-Based Medicine, which I'd highly recommend reading. And that explains how this whole illusion manifests really from what you were saying earlier about clinical trials. And actually, if you're a body assessing the evidence, the actual evidence on the table to assess who puts that there, that's the critical thing. Because if you're not looking at the right if you're not creating the right studies in the first place, you're going to get a very biased view of what is working and what isn't going to work. But not just that. A lot of these studies only look at short-term outcomes. They don't look at the big picture. It's going back to what I was saying about zooming in and just seeing a narrow slit of the problem without stepping back and actually saying, yes, but what's the long-term effect of this drug? A lot of the time, it's not properly examined.
In a sense, Sackett anticipated this. The father of evidence-based medicine, didn't he? He talked about the three-legged stool. So he had what the evidence said. And that's the one we're having the problem with now because the evidence is what vested interest wants to give us and other evidence is ignored. But he also talked about expert opinion, the gut feeling of the doctor, which basically has been ignored. And he also talked about patient preferences, which has basically been ignored. So two legs of the stool are basically ignored. What the patients want largely ignored. The doctor's gut feelings, well, doctors aren't allowed gut feelings anymore. They've got to follow the protocol. But the protocol is based on this evidence, but the evidence is highly selective. Evidence of things which are absolutely brilliant could be suppressed. The research is not done, the research is not commissioned, but the research which got a particular outcome that's desired, is paid for, gets to the table and is authorised. And that's before you even start talking about revolving doors and people going from regulators to industry and from industry to regulators. And the more I've learnt about this, the more uncomfortable I've become. And the more like you, Tim, I think we're working under an illusion of evidence-based medicine. Yeah.
And also always thinking about, okay, so maybe this drug does help in the short term with the symptoms, usually masking the symptoms, but what could that money have been spent on? How could we have helped that person eat better food, deal with their stress better? Holistic things that look at the big picture of someone's life, that the root causes of why people are getting sick in the first place. How could that money have been invested? A lot of the times when they're coming up with these guidelines, they're not asking that question. What else could we be spending the money on? And that is a huge part of the problem.
And masking symptoms isn't too difficult, is it?
No,
treating pain, treating inflammation. But all those things are quite easy to do.
There's a good argument that masking symptoms is a really bad idea because if you mask symptoms, you're disincentivizing the person from actually dealing with the root cause of their problems.
Give an example. Talk about fever, for example, Tim.
Well, fever, the body is, if you get an illness and you have a fever, your body is trying to raise your temperature because that's the optimal condition to deal with the problem, and it's evolved over millions of years to do that. And then someone comes along with a drug and says, well, take this and I'll reduce the fever and you'll feel better. But how many studies have been done that look at the long-term effect of that on our immune systems?
I find all of this so fascinating. The necessity to embrace complexity is either, I suppose, terrifying or it's. I think it's fantastic. I think the more you sort of embrace that this is a complex problem and it doesn't have a simple top-down solution, I find that invigorating. It makes me feel better in my place as a tiny cog within the massive machine. I think, I don't have to understand all of this. It's almost the point, because by not understanding, you'll ask better questions, and you might actually add by your contribution a tiny little nugget of something to the great sum of wisdom. So I find that complexity the whole point. And I was listening the other day to someone saying that while you put on sunglasses, but for obvious reasons, because it makes it easier to be out in bright sunlight, it's also if you're not wearing sunglasses and that light energy is going into your eyes, the necessary part of your brain's thinking sunlight going to get burnt, produce melanin. So if you wear sunglasses, that your body doesn't. Oh, it's dark. Don't need the melanin. Yeah. So now you need the sunblock because you put the sunglasses on to trick your body into thinking it's in the dark.
Yeah.
So you're going to get burnt. So you've got to put on sunblock. But you don't. But all of that would be taken care of if you just didn't put the sunglasses on. You're starting by that simple action of putting sunglasses on when it's sunny. You're a cascade of consequences. Now I need this, and now.
Well, just to go back to what you were saying, Don, you were asking for a good example, because the pyrexia one, it might not be the best example. Because actually, if you actually look at the guidelines for children, they do actually say that in the UK at least, that we should only be giving antipyrexic for children if they're distressed and they have a temperature. So we're not just treating the temperature. So that's one of the better. That's actually one of the better guidelines, actually. Yeah. But I think a better example would be just something simple like a lot of people take proton pump inhibitors to block stomach acid. Antacid ones. Now, so if you go to the doctor and you've got this acid burn, and they quite often put you on this
lansoprazole.
Yeah, the number of people that get stuck on this for life, and there is good evidence of long-term harm from taking these drugs.
Things that stop like heartburn and acid indigestion.
Yeah. So what you're doing, quite often there's a reason people are getting that burn. Quite often they're having too much sugary drinks and things like that, alcohol. And just lifestyle things, too stressed and that. So you're basically, the body's trying to tell you something, and you're basically taking this drug to mask that symptom. But then in the process, you're meddling around with the most complicated system with the gut, with all the bacteria that's been shown to be like a brain gut-brain axis. So much complexity.
B12.
Yeah,
it's not B12.
B12 absorption, and I think there's studies that show that there's links to dementia later on in life, and
from taking antacids. Wow.
Well, because you're
proton pump inhibitors.
Yeah, because you're basically mucking around with your body's
so you're curing heartburn today, and you're giving yourself dementia in 30 years' time.
Well,
wow.
Potentially.
Potentially.
Yes, I know it's high, but yes, it's that cascade of consequences.
Well, a lot of the time we don't look very detailed at the long-term consequences. To get a drug onto the market, you don't need to do these really long-term studies.
Which is a big part of the problem.
Yeah, you just show a short-term benefit, and then that's deemed good enough. But actually what happens is patients tend to start taking the tablet. It does solve the problem because it does mask the symptoms.
It does.
And then what they do is they find that if they stop taking it, the symptoms come back. Well, that's because they've been disincentivized to deal with the root cause of the problem. So if that drug wasn't available in the first place, and very often the doctor might give advice, lifestyle advice, but if the pain has been taken away, the person's not motivated to deal with the root cause of the problem.
See, changing lifestyle is a bit of a nuisance, really.
Yeah.
I want to do what I want, when I want, if I want. I want to eat what I want. I want to drink what I want, when I feel like it. And doctor, just give me a pill to make all the problems go away, please.
Yeah.
It doesn't work like that.
It's like the whole Ozempic
It's a pill for every ill.
It's that Ozempic thing.
I mean,
people who are overweight. I mean, I believe it was a drug developed for some aspect of diabetes, but it also makes people. It's an appetite inhibitor, so you can lose weight, but it's having God knows what other consequences in the longer term. Because
my concern is that you'll lose muscle from it, and muscle is critical to long-term health. Muscle mass is absolutely critical. So
I think what will happen is that the long-term harms will become evident, and then what happens is they'll change a few molecules on the side. Say, oh, well, we'll use this one instead.
Don't worry, we fixed it now.
Yeah, it's a playbook. And
we fixed it now.
You look at this, the psychiatry. That's an area where it's particularly bad. But again, I just want to add, there is nuance. I'm not saying we should never ever give antidepressants.
Absolutely
but
not.
We shouldn't be having millions of people on them. And then if you look at America, they're giving them to children. They're giving antipsychotics to children. The number of children in America now taking stimulants for ADHD, and they're showing that they're having effect on height. And then in long term
height,
over like 8 years, I think there's a study that shows that there's no long term benefit in most cases.
And the complexity within the body, I kind of like the fever example. Like deep in your brain, you've got a bit called the hypothalamus. The specific receptors there that work on something called prostaglandins, and they turn your temperature up when you've got a fever to optimize the efficiency of the immune system. And acetaminophen, paracetamol, ibuprofen, they'll all bring that down. They're all acting against the body's natural defense systems. Diarrhea is another good example, actually. If you've got diarrhea, the whole point is to...
Oh, yeah, take Imodium.
We wash it all out. The colon knows exactly what it's doing. It's washing out all the bugs. And take Imodium, symptom goes away, patient feels better, thinks you're the cleverest doctor in the world, but all the bugs are stuck in the colon. They're not going anywhere. And you can get amoebic liver abscesses and all sorts of problems, especially in Asia, from that. Right, I've got two questions really to finish up on. One is, what would be the way that we should go into the future? And the last question, which I'm going to leave till the end, might be a bit depressing, is how do you think the future is actually going to pan out? So first of all, Neil, how would you like to see things pan out over the next few years? What's your preference?
I just the drift, or actually the march, the frog march into censorship and silence. Yep. That's anathema. Yep. The censors are never the good guys. Yep. That's a fact of history. Yep. More information, not less, and I've got to a point now where if it was a binary choice between absolute freedom of speech, up to and including anything you want to say, however much offence you might cause, or where we seem to be going, which is being handed a laminated card every morning of not only are these the things you're allowed to say, but you jolly well better say all of these before the end of tonight, or there will be consequences.
You will say these things. Yeah.
I would have to pick the absolute unconstrained freedom of speech to say anything. Because it's got to be more information. There's got to be more conversation. There's got to be easier, ready access that people should be able to see whatever they want to see, and bad ideas that die in sunlight. If you let people think what they want and they say it in the public forum, they will be challenged by better ideas. If their idea, it's like the marketplace of ideas. If you come up with a good invention, the market will say it's a good invention because people will take it up. That's how the internal combustion engine replaced, the horse-drawn carriage, because it was demonstrably a better way to get around. And that's what if you take that away and force people to take electric cars, which is what they've been playing at, then it doesn't work. Because the infrastructure's not there, blah blah blah, so on and so on. So let ideas out, let people talk. And if they come up with dangerous ideas or bad ideas or stupid ideas, they will not thrive. Yeah. They will thrive in the dark. Yeah. They will. If you try and suppress things will find dark corners in which to live, and they will propagate themselves there.
It's almost like a natural selection, isn't it? Uh-huh. The Darwinian analogy: the good ideas will survive and the old ones will die.
And I believe a friend of mine, you're aware of him, Nick Hudson. Mm-hmm. He came up with this Hudson's razor. Hudson's razor. This heuristic where he says, you can tell a scam because of three things. if it's global, if it affects the whole world simultaneously, if there's a one-size-fits-all top-down solution, and if any dissent from it is to be crushed. He said, if you can tick those three boxes in relation to anything, a pandemic, the climate, you're dealing with a scam. Yeah. And I think that is absolutely the case. So you've got to get away from this this tendency that is there to go for ignoring complexity, imagining that you can find a simple answer that you can apply it across the board and top down. Get away from that, and it's subsidiarity. Let decisions being made at the local
level, yeah.
And a multiplicity of options. Give people choice, away from mandates. You make things available. Be honest with people about what they are. Tell them that there may well be risks, because whatever, you can take it if you want, but don't mandate it. Let people opt out. It's that kind of openness.
Yeah.
Embrace complexity. Don't indulge the arrogance of the hubris of imagining that we can be handled from the top by a star chamber of half a dozen people who are, billionaires, super smart, and they make all the decisions. And that's got to be it for us. Subsidiarity, local.
Decisions taken as low down the food chain as possible.
That would be me. That's where I would go.
Yep. Tim?
We need to embed the dissent into government. The people who are making decisions, there should be sort of red teaming. At the moment, there seems to be it's sort of unfashionable to go against the grain. Yeah. Whereas they actually need to have people saying, are you sure that's a good idea because of this, 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 and this? And that needs to be not just in the top government, but really at every level, right down to the department level, where people are looking critically at policies and looking at the big picture and saying, is this good for the health of the nation? And that's not the way we are at the moment with all the siloing. But I am actually quite hopeful, actually, because I think because of America. Because America has this tendency to do everything big. So the whole COVID response was completely over the top. And we think it was bad here. Over there, it was completely and utterly bonkers. And, well, it was completely utterly bonkers here too, but they somehow managed to make it even more crazy over there. But I'm just hopeful that this pushback against all of the issues that we've been discussing will be massive over there during this presidency. And hopefully there'll be some navel gazing. And America always tends to lead the way. So the ideas that are happening over there will hopefully come over here with some time.
And if they can identify truths which are basically incontrovertible, then hopefully we'll have to acknowledge them here.
Yeah, because the entire research architecture in America was trapped in that paradigm of thinking that we were talking about. And the people coming in now in charge are talking about redirecting research to actually look at the big picture, look at root causes of disease, and deal with a lot of these problems. As we start to now look at these issues scientifically and start producing evidence, because there is a lack of evidence of some of the harms, we will hopefully, it will force authorities around the rest of the world to take note, because America does tend to always lead the way.
And hopefully the journals will print that, which is a problem at the moment as well.
What's your answer to that question? What do you want the future to look like?
At the moment, we're in a situation where people kind of know what they're not allowed to say, and that's not a good place to be. So I want rid of the censorship. I want freedom of speech. I want to be able to discuss ideas, even if they are offensive, even if they go against the scientific narrative. I want general discussion, and I want science to be liberated from censorship. I want science to be liberated from financial vested interest to become pure empirical science again. And that's true of medicine as well, but it's true of everything in society. So we need an openness, and that means we're going to need to have honest reflection of this in the versions of this that come out to the population at large. That means we're going to need honest media outlets, which is a problem, but so the work needs to be done, and that needs to be communicated to everyone in a free and open way that everyone can give feedback to. We need to get rid of the censorship. We need to get rid of the vested interest. We need to get rid of the threat, which I've had overt threats, and we need to get rid of. We need to get rid of those so we free the human spirit. We need to be free to talk about when life begins, when it ends, and everything that should happen in between. And at the moment, we're not. We need that freedom back, because we are capable of really quite significant scientific advances if we have the freedom to do so. Operating under this tyranny that we have at the moment, whether that's overt or covert, it just stifles science. Because if you can't have dialogue, if you can't have thesis, antithesis, synthesis, you're not going to get development. So we're in a sort of the control of the narrative at the moment has resulted in science at best stagnating, at worst, science becoming the slave of vested interest. And that's what terrifies me. You know, Churchill talked about ideologies with perverted science. And if we do pervert science, that's got the potential to do serious harm. So, Tim, you think you're fairly optimistic because of what's going on in the States, finding out what's happening in the States, acting as an example to here, that's fine. Neil, optimistic, pessimistic?
I think, optimistic or pessimistic, I'm coming to the conclusion that we are on the cusp of major change. You know, you've used the word today quite often. I've heard you use the word paradigm. Mm-hmm. Yeah. And I think something that we've been living under, is coming to the end of its useful life. I sense an end of empire feel. You know, empires come and empires go. Yeah. I also feel that systems seem to be in place for about 100 years, and then they are happily or unhappily reset. You know, with something 1815, end of the Napoleonic Wars and the Napoleonic era, and then 100 years later, we got the First World War, because war is how the powerful reset. Yeah. That's the reset button. And then, you know, World War I, World War II was essentially the same thing, the continuation of the same reset. And now, almost 100 years later, I think one way and another we're on the cusp of great change. And I could be optimistic, because I think something has lived out its useful life. You used the word stagnate. I think there's an entropy. I could be optimistic if I thought enough people were even open to the possibility of change, rather than just rearranging deck chairs on the Titanic, applying, treating symptoms and not underlying causes.
Well, I think the way I look at it
that's a social. We need to do that with society. I think there's an underlying societal, civilizational sickness.
I agree.
You can't just keep giving it ibuprofen and a sticking plaster.
I agree.
You've got to get to the underlying cause.
And agree more.
Because if you don't, the burden is going to get too high, basically. And so, whichever way you look at it, either we fix it now and it'll be fixed, or it's going to collapse. Like there will just the disability burden from just the metabolic health catastrophe that's playing out right in front of our eyes. Just go in any supermarket and just see the absolute garbage that's being fed to the population.
People are sick. You can see it around. The number of people that are lumbering about, morbidly obese, walking on sticks, pushing frames, not old, in their middle years, grey of complexion, grey of pallor. Yeah. You can see the unwellness, the simmering unwellness.
So you've got that sickness in the population, but there's also an economic sickness. You look at the cost of electricity and gas in this country. We just cannot power industry with these unsustainable
it's absurd.
Economic figures, basically. So we are going to collapse on this road that we're being taken down. And so either we deal with it now and recognize it now, or I see that we collapse and have to deal with it then. But if whatever happens, I think it collapses, and something hopefully new is born from that.
But this is happening in so many areas of life, whether we're talking about mass societal change, which we're undergoing at the moment, whether we're talking about science, whether we're talking about medicine. So many things do seem, I agree with Neil, seem to be coming to a head. And it could go either way. But it's in our hands. And
Trudy always says, Trudy's an optimistic person in a way that I am. And we complement each other in that respect. And, Trudy sort of inculcates in me this sense that even if you aren't, you're obliged to be optimistic. To some extent, I don't think my mum used to say you can choose to be happy.
I don't know.
Or you can choose to, and Trudy insists that you can choose to be optimistic, and I sometimes feel obliged to do it even when I don't feel it.
Personally, I'm concerned. But Yep. And on that note of uncertainty, Tim, thank you very much. Neil, thank you so much.
Thank you, Dr. John.
And thank you for watching.